Major challenges that cardiologists confront us with is, in general said, improving outcomes and reducing cost of their care. And this comes in very many different aspects. It comes from really large projects. Some of our customers are up to building new heart centers and rethinking the entire way of how patient care is being delivered in the future. And there we have the challenge of envisioning how will cardiovascular care be done in 10 years, 20 years from now. From early detection, prevention, diagnosis, therapy planning, therapy follow-up. And this is a huge challenge for both our customers, but also we are very happy to take on that challenge. So that's a very systemic one. And then we face a lot of challenges that are mainly driven around providing better therapy outcomes for dedicated patient populations. So we have the major patient populations: coronary artery disease, structural heart, arrhythmias, but also heart failure. And there is distinct solutions for all of them. There is, for example, in coronary artery disease, an ever-increasing need to be more accurate in acute settings, in identifying patients that need treatment and ruling out patients that do not need further treatment. And then also in the chronic, in the patient population of chronic coronary artery disease, this is just getting more and more. It's increasing, so also the workload associated with it is increasing. We have to make sure that we at best combine our technologies from lab testing with high sensitivity troponin over CT testing and then into the interventional lab, that we combine our offerings and make this pathway as streamlined, as efficient as possible. This is one challenge in coronary artery disease, so I would say making these processes more efficient. In structural, it's a different approach. There we see a huge amount of new therapies on the horizon in the mitral space, in the tricuspid space, and other therapies. And our customers expect us to be ready to support them in this next gen procedures. That means real-time image guidance, integration of planning data into their therapy. And this is something, again, where we make use of all of our technologies available, including ultrasound real-time guidance, to make sure that our customers can achieve the next generation of outcomes. And in arrhythmias, it is again the thing where we are really encouraged with our customers to provide the next level of outcome improvement in atrial fibrillation, in future also in ventricular tachycardias. And our customers are looking, of course, for the obvious things, simplifying their procedures, being very well integrated with EP technologies, but also on the horizon to see what new technologies, what new imaging information can help us to make our therapies more individualized. So this is just 3 examples of what we are talking about with our customers. Well, we have a dual strategy, I would say. The first thing is that we concentrate on how can we best combine our technologies within the company to focus on the individual patient populations and their needs, especially in the therapy space. We do this by assorting them along clinical pathways, which we elaborated together with our customers for structural heart disease, for arrhythmias, for coronary artery disease, and do exactly what I just illustrated to respond to the challenges of answering which data do I need where, which decisions do I need to make where, how do I better guide my treatments. So focused on each segment, on procedures along the clinical pathway, we assort our offerings. That's the one part. The other part is that, of course, we know that there's more needed than our technologies to provide better outcomes. That means we partner, and this is part of our core strategy, with the best industry partners in these respective segments, and together provide the next better generation of solutions. This is what our customers expect, that we give them the freedom and that we provide them with the next better combination of solutions for arrhythmias, for structural heart and coronary artery disease.